Hey guys, welcome everybody. Welcome to another session of Secrets of the USMLE, how to dissect any question on test day. Excited day, we're going to do the endocrine edition. So get ready with all your diabetes and all that good stuff. So we got a couple of guest presenters tonight and panelists, and so I want to introduce you. So first of all, my name is Tally. I am an associate clinical professor and chief of allergy immunology at the University of Louisville in the Department of Medicine. I'm also better known as the senior editor for the First Day for the Board series and the USMLE-Rx test bank series. My co-presenter tonight will be Paras. So Paras, would you like to introduce yourself?
Sure, thank you, Dr. Lee. Hey everyone, my name is Paras. I am currently a dermatology resident physician at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school in St. Louis, Missouri, and then decided to further pursue medicine at medical school back home in Michigan. I've worked with RX for a little under a year now in various capacities, primarily as an RX coach, where I've worked individually one-on-one with students, primarily for the USMLE Step 1.
Great. And we also have some fantastic panelists as well. So Sean, you want to introduce yourself?
Hi guys, Sean Nanji here. Been working with RX Coach for about a year and a half on the RX Coach program with Dr. Vicaria and Mark, who you'll meet shortly. Looking forward to answering your questions as always, and happy to be here.
Great. And our other panelist is indeed Mark.
Hey guys, my name is Mark Heslin. I'm a third-year med student at Cooper Med School of Rowan University. I've also been an RX coach for about 6 months now, and I'm excited to answer all your guys' questions.
Great, fantastic. And so, as you can surmise, we will be answering your questions during the webinar. And so, you know, for those of you who are on a PC or a Mac, there should be a Q&A panel in the tabs. There's a control tab on the right side, and it should say questions, or it's in the app tab up front on top, you know, for the Mac. And I think for the iPhone and Android and iPad devices and stuff like that, there should be a question icon that allows you to answer questions. And so, you know, Sean and Mark and others will try to do their best to answer questions as we go through this very, very interactive discussion. All right, great. So let's move on to the next slide here. And so I'll just do a quick rundown of the agenda here. We're gonna do now that we've done the introductions, we're gonna do also an update with regards to COVID-19. We'll talk a little bit about RX bricks and you know, how they work with your studies, especially when breaking down questions. And we'll provide an example, and we'll talk about our approach to answering questions. Then we're going to do a number of question dissections, and then provide some general advice for dissecting questions, some study tips, and then at the very end there's actually a raffle and special offer. So if you are here and present at the end of this presentation, we may call your name. You have to be present, and we have some very, very nice prizes, including an RX coaching package with access to USMLE-Rx, bricks, and so forth. And then at the very end, we'll answer questions. We'll do some Q&As and open it up for anything you want to talk about. All right, great. All right, so just a quick update. This on COVID-19, as you imagine, this is a very, very fluid scenario. Things are changing almost every week. They did just post an update a couple of days ago. As you're aware, they are resuming testing at some centers, and they will increase capacity. Based on conditions on the ground, on what the states are doing, and so forth. And a number of people have already been hearing from the prometric centers and whatnot, but it's still kind of an up and down, very, very fluid situation. So just be aware and just be patient, because I know there have been some screw ups and whatnot, and so that's unfortunately part of what's going on, and I recognize that that's a very stressful thing. They are also, the NBME USMLE is also looking into testing outside, Prometric, and so they're working to potentially set up testing centers at medical schools, or for repeated testing, or for one-time testing, and perhaps even looking at remote proctoring, though we don't know any of those details. The other thing that you're certainly aware of is that a couple of weeks ago they were supposed to actually introduce some changes to the USMLE Step 1. In particular, there are going to be new patient communications questions, and they're moving some of the medical management questions, treatment questions, out of the Step 1 more to the Step 2, where there are a bunch of those questions, and also things like healthcare, quality, health system science, and some of that is also being transitioned to Step 2 from Step 1. But they've made a decision to delay that, and that will not occur until September of this year at the earliest. So again, you'll need to keep an eye at usmle.org for the latest announcements, but that's what we know of as about 5 days ago. All right. Okay, so I'm going to talk a little bit about our bricks. This is a new resource that we've recently developed. We're really super excited about this. Many of you have are been long and faithful users of our platform, so you already know this. You already know that the dashboard with access to QMax1, Flash Tracks, and Express Videos, and you got ARCS 360, QMax2 if you happen to be subscribed to that, and then our ARCS bricks, which has been been underdeveloped for a while and been publicly available for the last year or so, and getting to where we have all the collections, and so we consider these to be very high yield foundational learning experiences that give you the basics of what you need to know, not only for your classroom, but also on the wards. We try to integrate the key basic and clinical concepts, not just what you need to know for the USMLE Step 1 or Step 2. And what you'll notice is that we teach in a very conversational way. We try to provide relevant examples. We've got a very clean learning environment. You'll notice that the bricks are rich in images that you can zoom into, and they're also interactive. You'll notice that we embed flashcards throughout, so you can test yourself on what you are reading. And as you go through it, you can see more images. Even the mnemonics are testable. So remember 3 Ps of ME1, and then you can quiz yourself on what those 3 Ps actually are. And as you go through, there's more mnemonics, there's more flashcards, images, self-testing. You can actually highlight and annotate the material, and those highlights and notes are available to you, even after your subscription expires. We have a high yield summary at the very end that's linked to the learning objectives, and then you can see that we also provide practice questions as well. Some of the practice questions are USMLE style, some are not. It's really meant to test your understanding, your competency with regards to the topics. And then what you'll notice is that as you answer the question, if you don't get the question, then you actually have to keep answering until you do. And so you see that I got this on the second attempt, and then it explained why D is correct, but why B, mesothelioma, is not correct, right? And then you can see that there's multiple questions, and then you can do a kind of a learning check to see whether you're able to address all the learning objectives. If you can, then you can go back up there and review that part of the brick. and then check off. And once you check off, then you can you can get the completion on the brick. And then the cool thing is that if you're also a subscriber to RX 360, or you have the total package, you can access all the test prep stuff that goes with the Go Deeper section. So that includes access to first aid here, and you can see this is the actual fact. And again, you can highlight, annotate here as well too. You can also do flashcards. I won't do them right now, but you can do 20 flashcards that have been curated to go to along with the multiple endocrine neoplasias brick, a video about this, and 14 QMAX questions that gives you plenty of test prep. All curated, based on the brick that you're in. All right, and so this is something that you can do as part of your primary learning, go along with your courses, before you get into doing the QMAX questions. All right. The other thing I'll just mention here is that we also just last week released a coronavirus brick, so do check it out. It's been very popular, and it's just a demonstration how we are trying to keep current and keep you updated with things that are emerging on a weekly and monthly basis, but that's also clinically relevant and important for you. Great. So now let me just get back to the presentation. So we're talking about the bricks here, and so getting back to the USMLE question types, on the USMLE you have really only one type of question, which is the one best answer, and there are some variation in one best answer. Some of them have multimedia. Almost all of them have clinical vignettes, and the majority, I'd say about half of them, have multi-step reasoning, and so that means that they integrate multiple concepts together. So it may start with a clinical presentation, so you're thinking about the pathology, but then it may ask, what's the genetics of that, or what's molecular. So you have pathology matched with genetics, pathology, then treatment, or pathology, pathology treatment, and then the pharmacology of the drug, that type of stuff. So that's how they may integrate multiple concepts together. And one of the pieces of advice we often give is, when you learn something, try to connect it to everything else that you're learning, because that's exactly how the USMLE will do it as well too. On the USMLE, this is a bit of an oversimplification, but it gives you a sense of what kind of shows up on the USMLE, the various steps. For step one, there's the preponderance of the questions are about mechanism. There's some diagnosis and very little, and some management, and much less management, after September. On the step two, you're going to see more diagnosis, some mechanism, and more management. And on step three, a lot more management, some diagnosis, and a little bit of mechanism with regards to the mechanism of disease. All right, and then in terms of the blueprint, you'll notice that the preponderance, of the exam is on, about half of it is on pathology, integrated with physiology, and all the other foundational concepts. And when they talk about the foundation concepts, it's mostly organ systems type stuff. All right, so at this point, I'm going to hand it off to Paras.
Thank you, Dr. Lee. So there are different approaches to board type questions, and today we'll be using the question approach that we use in the RX coach program. We talked a little bit about that, but that's one of the new tutoring initiatives by USMLE-Rx, and we'll talk a little bit more about that later in this webinar. That being said, let's go ahead and talk about our 7-step approach to questions. We'll go over the steps with you now, and then we'll do some questions together using this approach so that you can become familiar with it. So step number 1 is to cover up the answer choices. You can use a Post-it note, piece of paper, your hand, whatever you need to do. The reason we ask you to do this is because we don't want you to become preoccupied by those answer choices and then have those answer choices guide your thinking before you even look at the actual question stem. This also helps students from getting confused and feeling overwhelmed. So let's move on to step number 2. So at this point, we read the last sentence first. And as we do that, we will highlight and make note of anything that we think is important. We do this so that we know what to look for as we read the question. And with any luck, this will help us avoid having to reread the question and waste precious time. So now let's move on to step number 3. For this step, we like to think about how many steps does this question require to get to the correct answer. So the USMLE can have 1-step, 2-step, even 3-step questions. So what does that mean? Well, let me give you some examples. So if a question is asking just for a diagnosis, that would be a 1-step question. If it asks you how to treat that condition the patient has, well, first you have to figure out the diagnosis, the first step, and then the second step is identifying treatment or treatment of choice. If it asks you what is the mechanism of action of a drug used to treat the condition that the patient has, well, then that would be 3 steps. 1, figuring out the diagnosis, 2, identifying the treatment, and then 3, knowing the mechanism of action of that drug. So don't worry too much about it if you can't remember all of these steps. We'll practice this as we go through these questions. But let's talk about why this step is important. This step allows us to have a clear thought process as we approach the question. So by knowing how many steps it will take us, we can avoid having to reread the question. And then this will also help us identify relevant clues in the question step so that we can answer the question correctly. Let's move on to step number 4. So in step number 4, we will read the question 1 sentence at a time. After each sentence, we will highlight and make note of what is important to us, while also thinking of what we should take away from that sentence. This will help us remain consistent with the question approach and our thought process. And it will also help us to avoid having to reread the question. Now let's move on to step number 5. So once we have read the entire question, we will reread that very last sentence. And at this point, we want you to start thinking of potential answer choices before we even uncover the answer choices, and start to try to narrow those down in your mind. So let's move on to step number 6 now. So this is a pretty simple step. And this is basically just uncovering the answer choices that you've been so anxiously wanting to see. Now let's go to step number 7. For this step, we will start at the last answer choice and work our way up. Students often ask us, why do we do that? So we do this to make sure that students are looking at all of the answer choices before picking an answer. And you're not getting distracted by an answer choice that you think is correct and may in fact be incorrect. So we will start with the last answer choice and cross out answer choices that do not fit what we were thinking. Hopefully we'll find a right answer that fits our thought process, and better yet, find an answer choice that we thought was the answer before we even uncovered the answer choices. Then we can select that answer and move on to the next question. So now that we've gone over our approach to the questions, let's try to do some questions together. So this is question number 1.
Hey, Paras.
Oh, yep.
Sorry to interrupt. I forgot to actually, ask a question just to make sure we understand who's on our webinar tonight. So I'm going to take a minute here, if you don't mind, before we actually get a question to kind of find out who's out there. So there is a poll I'm about to launch. You should see it pop up on your screen. We just want to know who's here tonight so we can better tailor the feedback that we're giving. So you could just kindly select the choice that best describes who you are. We'll collect that data and then we'll share it back with you as well too. So the first is we want to know what type of student you are or learner you are, whether you're a physician, whether you're a medical student, and are you in the US or outside the US. So we'll give it about 20 seconds. I apologize, should have done this at the very beginning of the presentation. All right, looks like about half of you have answered. I am going to wait for another 10 seconds till we get close to 2/3 or 3/4 of the people answering. getting there. We're creeping up to 71. All right, looks like we're at 75%. So I think I've got plenty of data. I'm going to close the poll, and I'm going to share the results. And what you can see is that the majority of the folks are international medical graduates, from outside North America. But we also have some representation from U.S. medical students and IMGs that were born in the U.S. All right, great. So now I'm going to ask another question, which is, when are you planning on taking the USMLE Step 1? Is it sometime this year or next year or the year after? So again, pick the answer that best matches your plans. So again, we'll leave this open for about 30 seconds or so, and looks like answers are coming in faster now, since people know that I'm answering you questions. So let me leave it open for a bit, and then once we get a quorum of responses, then I'll go ahead and close the poll. All right, we are at 60%. Wait a couple more seconds, and here we go. All right, most people have answered. I'm going to close the poll and share the response. And you can see, the majority of the folks are going to be taking it from July to the end of the year to 2021. Actually, that's the most popular response. There's some folks taking it in 2022 and beyond, which is when the USMLE Step 1 is expected to go pass-fail. So again, this is helpful to understand, so we can tailor our advice to you guys as a group. All right, so let me go ahead and minimize that, and then I think we're ready to go into question number 1. Back to you, Paras.
Awesome, thank you, Dr. Lee. So now that we've gone over our approach to questions, let's go ahead and do some questions together. So again, we'll begin with step number 1, which is to cover up those answer choices. As you can see, we've already done that. So we will move on to step number 2, and that is to read the last sentence first. So in which area of the adrenal gland is this one functioning steroid hormone produced? Okay, great. So we are looking at a physiology question most likely. And the key thing here will be, what is that steroid hormone that they are talking about in this question? We can now move on to step 3 and figure out how many steps that this question requires. By looking at this, we can tell that this is probably a 2-step question. First, we need to figure out what the hormone is that they are referring to, and then remember where in the adrenal gland it is produced. So let's move on to step number 4 and read this question one sentence at a time. So we recommend you pause briefly after each sentence to highlight if needed and maintain a clear thought process. You can ask yourself, what is important in this sentence? What is this question asking me? What am I needing to pick up on here? So for today, I'll kind of pause a little bit after each sentence and allow everyone at home to gather their thoughts, okay? So let's go ahead and read this question. An 18-year-old woman is referred to a specialist because she has not yet begun to menstruate. She reports generalized weakness and occasional bouts of nausea and vomiting. Her blood pressure is 160/99, heart rate is 92 beats per minute, and respiratory rate is 16 per minute. Physical exam is noticeable for the lack of breast development consistent with Tanner stage 1. Laboratory studies show a serum potassium level of 2.2. She is diagnosed with a condition that decreases the production of 2 of the 3 major adrenal steroid hormones, leading to an excess of only 1 functioning hormone. So now that we've done that, let's move on to step number 5 and reread that last sentence, the actual question part. So in which area of the adrenal gland is this one functioning steroid hormone produced? So I want everyone to take a second to think of what you think this answer could be. We'll give everyone a quick second or two. And now we'll move on to step number 6, and that is to uncover the answer choices. So we'll go ahead and show those to you now. So here are the answer choices. So now we'll move on to step number 7. For this, we want you to start at answer choice E and work your way up. Go ahead and select the answer that you think is correct. We will go ahead and give everyone a second to do that.
All right, great.
So
let me go ahead and open up the poll here.
perfect.
Give me a second. So hopefully everybody has an answer locked in. So this should be quick. So obviously B, C, D, or E, and we'll launch the poll, and then go ahead and lock it in. If you think it's the capsule A, if you think it's the medulla, click B. If it's zona fasciculata, click C. Zona glomerulosa, click D, and if it's zona reticularis, click E. All right. We will give you folks a minute. About 25% of you guys have answered. And just go ahead, if you're unsure, just go with your best answer. So so we can move on. And one of the things that for you folks that you might, especially if you haven't taken this exam before, is that there is no penalty for guessing. So go ahead and guess if you don't have a clear answer. All right, looks like most of the folks have answered the poll. Let me go ahead and close it. And then I am going to share the results here. And as you can see, close to half of you folks said D, zona glomerulosa. All right, and then let's get back here and see what the answer is. The answer is indeed D, zona glomerulosa.
Great, thank you, Dr. Lee. So let's review this together. So for this, we will start at answer choice E and we'll work our way up. Some of you had selected answer choice E. So zona reticularis. The sex steroid hormones are produced here, and an excess production of this would lead to signs and symptoms of virilization. But this patient actually presented with amenorrhea and a lack of breast development. Remember, they told us she was Tanner stage 1. So this actually suggests a decrease in circulating sex hormones, so E is likely incorrect. D, which is a correct answer, which a majority of you picked. So this female presented with primary amenorrhea, hypertension, and low potassium. She's diagnosed with some congenital adrenal hyperplasia disorder. From her clinical presentation, we can tell that it's most likely a 17-alpha hydroxylase deficiency. So in this deficiency, you have low glucocorticoid and low sex steroid synthesis, but you have increased mineralocorticoid synthesis. This increased mineralocorticoid synthesis leads to increased sodium retention, or hypertension as this patient had, and also increased potassium excretion. Keep in mind this patient had low potassium. Also, because of the low levels of sex steroids, she would have decreased sexual maturation, and this is seen in our patient who had primary amenorrhea and Tanner stage 1 sexual characteristics. And then lastly, mineralocorticoids are produced in the zona glomerulosa, and why answer choice D is a correct answer. C, the zona fasciculata. Cortisol is produced here, and an excess of cortisol would lead to a Cushing type presentation. So you could have hypertension, but you would also have other signs and symptoms such as weight gain, central obesity, fatigue, skin thinning, among many other things. This patient's clinical presentation is not indicative of an excess cortisol synthesis and an incorrect answer in this question. B, the medulla. So the medulla produces the catecholamines, epinephrine and norepinephrine. Overproduction of these could manifest with hypertension, but you would also have other signs and symptoms such as palpitations, flushing, sweating. Her clinical presentation is not consistent with excess catecholamine production, and she also presents with other things such as decreased sexual maturation, which are not indicative of catecholamine synthesis defects. And lastly, answer choice A, capsule. The capsule actually does not produce any hormones and therefore is not responsible for any of the symptoms or signs in this question. So that is also an incorrect answer. Well, great job with that question. So we've kind of gone through our steps in question number 1. Let's move on to the next question and keep working on those steps. So question number 2. So again, we will cover up those answer choices with our first step. We've gone ahead and already done that, as you can see. And then we'll move on to step number 2. Read that last sentence first. So which of the following is most likely responsible for the patient's symptoms? Okay, great. So we're looking for what is most likely causing the symptoms. That is something that you may want to highlight. So let's move on to step number 3 and figure out how many steps this question requires. Well, by looking at this, we can say that it's probably a 2-step question. First, we need to figure out what is going on with the patient, or what is the diagnosis. And then we need to figure out what is the pathophysiology behind the disease. So now let's move on to step number 4 and read this question one sentence at a time. A 43-year-old man presents to the office with complaints of watery diarrhea for the last 6 weeks. He also reports brief episodes of complete paralysis in his lower extremities. Review of systems is significant for muscle weakness and lethargy. He states that his family has a history of numerous tumors. Physical exam shows reduced peripheral vision. The pH of the patient's gastric juices is significantly elevated. They also tell us that an abdominal mass is noted on CT scan. His lab report shows he has a sodium of 136, potassium of 3.2, hemoglobin of 10, a random blood glucose of 210, and a calcium of 12.5. So now that we've gotten to the end, let's move on to step number 5 and reread that last sentence. Which of the following is most likely responsible for the patient's symptoms? Great, so once again, I want you guys to take a second to think of what you think the answer choice is. And this is before we uncover the answer choices. And now we'll move on to step number 6, which is uncovering those answer choices. Here are those answer choices, and now we will move on to step number 7. So again, we want you to start at answer choice E and work your way up. Go ahead and select the answer choice you believe to be correct, and then we will talk about it in just a few seconds.
All right, I'm going to go ahead and open up the poll, and I'll let you guys lock in your answer. So here we go. The poll is now open, should be launched, so you should see a poll showing up on your screen, and you can punch it in the answer. All right, about 10% have answered. All right, half have answered. I'll wait a little longer. All right, about 2/3 of you guys have answered, so I think that's a good response rate there. So I'm going to go ahead and close the poll and share the results. Looks like the most popular answer is increased VIP, and the second most popular answer is increased gastrin levels. So we're certainly going to talk about that. So let me go ahead and get back to the presentation, drop the poll. And indeed, the answer is increased vasoactive intestinal peptide. Right, Ross?
Great, thank you, Dr. Lee. So let's review this together. So once again, we'll start at answer choice E and we'll work our way up. So increased vasoactive intestinal polypeptide, or VIP. So this patient had chronic watery diarrhea, hypokalemia, increased gastric juice pH, which is referring to achlorhydria, and an abdominal mass on CT. These are all consistent with a neuroendocrine tumor called a VIPoma that secretes VIP, and this originates from the pancreas. Now remember that VIPomas are often referred to as WDHA syndrome. WD standing for watery diarrhea, H for hypokalemia, and A for achlorhydria, which is what our patient had. Keep in mind that although they gave us a low potassium of 3.2, the patient also had muscle weakness and periodic paralysis, which also suggests hypokalemia. Furthermore, this patient has clinical evidence that suggests that he might have a diagnosis of something we talked earlier about in this presentation, or MEN, multiple endocrine neoplasia type 1. As Dr. Lee had showed on those flashcards, is characterized by the 3 Ps: pituitary tumors, parathyroid adenomas, and pancreatic endocrine tumors. Now, they told us that his calcium is elevated, suggesting he may have parathyroid involvement. And they also told us that he has peripheral vision loss, which could be suggestive of a pituitary adenoma. So a lot of subtle clues here in this patient as to what's going on. And that's why answer choice E, or a VIPoma, which is a pancreatic tumor, is a correct answer here. Answer choice D, increased serotonin levels. So this is getting at a possible carcinoid tumor. Carcinoid tumors are also neuroendocrine tumors that may secrete substances such as serotonin, and when they metastasize, they may cause carcinoid syndrome. Now, this does include diarrhea, but it also includes other things that we are not seeing here. That includes bronchoconstriction, cutaneous flushing, potentially right-sided valvular heart disease. So although this patient has diarrhea, this patient doesn't have those other signs and symptoms, and likely an incorrect answer. Answer choice C, increased insulin. High levels of insulin are seen in insulinomas. These produce large quantities of insulin and are characterized clinically by the Whipple triad. Now, this triad consists of symptoms of hypoglycemia, such as palpitations, tremor, diaphoresis, which this patient does not really have. Also, a documented low plasma glucose. They told us that this patient's random blood glucose was 210, so inconsistent with that. And then the last part of that triad is reversal of symptoms upon glucose administration. Not really relevant in this question. So although insulinomas are associated with MEN type 1, the patient's clinical presentation does not fit with an insulinoma. Answer choice B, increased gastrin level, which was our second highest selected answer. So high levels of gastrin are seen in a gastrin-secreting tumor called a gastrinoma. By secreting excess quantities of gastrin, this reduces stomach pH. Although gastrinomas can cause diarrhea and they are associated with multiple endocrine neoplasia, the pH of the nasogastric suction fluid would be decreased. However, they told us that it was actually elevated. Thus, that is a key clue there that tells us it is not answer choice B. And lastly, answer choice A, increased catecholamine levels. This could be seen with pheochromocytomas, and they are characterized by episodic headaches, sweating, hypertension, and other symptoms that are adrenergic in nature. However, they are associated with MEN type 2A and 2B, not MEN type 1. Also, this patient isn't displaying any of those signs and symptoms that you would see with the pheochromocytoma that we just talked about, so likely incorrect as well. So far we've covered our approach to questions and done 2 questions together utilizing that approach. So let's go ahead and try to do a third question together. Question number 3. So again, we will go ahead and remove those answer choices for you, which is step number 1. Step number 2, we will read that last sentence first. Which of the following antibodies is most likely to be found in this patient's blood? Okay, great. So we're looking for an antibody that we would find in this patient's blood. Okay. So now let's move on to step number 3 and figure out how many steps this question requires. So by looking at this, we can tell that this is also probably a 2-step question. First, we need to figure out what the diagnosis is. What is going on with this patient? And then the second step is we need to figure out what antibody is associated with that disease. So let's move on to step number 4 and read the question one sentence at a time. A 47-year-old woman presents to her physician complaining of weight gain, fatigue, and lethargy. The symptoms started about 5 months ago and have progressively worsened. She had been doing daily morning walks, but can now only walk half a mile before feeling too tired to continue. Her blood pressure is 100/50. Her pulse rate is 52 beats per minute. Her physical exam shows dry skin and delayed ankle jerks. Her thyroid gland is mildly enlarged with no tenderness to palpation. Fine needle biopsy of the thyroid gland reveals lymphocytic infiltrates with a few germinal centers. So let's move on to step number 5, reread that last sentence. So which of the following antibodies is most likely to be found in this patient's blood? So once again, I want you guys to take a second to think of what you think the answer may be before we uncover those answer choices. So now we will move on to step number 6, and that's uncovering those answer choices. Here are those answer choices. And now we'll move on to step number 7. Remember, for this, we want you to start at the bottom, answer choice E, and work your way up. Go ahead and select the answer choice you believe to be correct. We'll go ahead and open up that poll, and we will go over the answer in just a few seconds.
All right, hopefully everybody has an answer or your best guess at an answer. So let me go ahead and open up the poll here. And so if you think it's anti-TSH receptor, pick A, anti-U1-RNP, pick B, anti-centromere, pick C, anti-mitochondrial, pick D, and anti-thyroid peroxidase, pick E. All right, we've got about 30 guys answering. Let's leave it going for a little bit. All right, close to 2/3 of you have answered it. 70% have answered. Okay, good. Looks like we're at 75. Okay, let me go ahead and close the poll and share the answers. And 2 spikes here actually, so very interesting. 56 of you answered E, anti-thyroid thyroid peroxidase antibodies, and almost everybody else went for anti-TSH receptor antibodies. So this will be a great discussion, and then a smattering of folks in the middle. So let me go ahead and close the poll, and then let's get to our answer, which is indeed anti-thyroid peroxidase antibody. All right, so back to you, Paras.
Thank you, Dr. Lee. So again, we'll kind of go through these question answers again. So answer choice E, anti-thyroid peroxidase. So this patient presented with weight gain, fatigue, let's not forget her bradycardia, dry skin, and delayed tendon reflexes. These are all signs and symptoms of hypothyroidism. In addition, they told us that she has an enlarged thyroid gland. They did a fine needle biopsy, which showed lymphocytic infiltrates with germinal centers. This constellation of findings suggests Hashimoto's thyroiditis. Now, this is an autoimmune disorder characterized by autoantibodies against certain thyroid antigens. This ends up leading to hypothyroidism, which is what our patient had. The 2 most common autoantibodies that are targeted are thyroglobulin and thyroid peroxidase. Hence why answer choice E, or anti-thyroid peroxidase, is the correct answer here. Answer choice D, anti-mitochondrial antibodies. This antibody is highly specific for primary biliary cholangitis. This is also an autoimmune disease, but of a different system, the liver and biliary system. So patients would present with fatigue and pruritus, and then they would present with signs of cholestasis, So jaundice, pale stools, dark urine. This patient's clinical presentation is not consistent with that, so likely incorrect. Answer choice C, anti-centromere. These antibodies are associated with crust syndrome. It is a limited form of systemic sclerosis, and it is characterized by calcinosis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasias. There really was nothing in this clinical presentation that was consistent with any of those parts of that acronym CREST, so also likely an incorrect answer. Answer choice B, anti-U1 RNP antibodies. This is suggestive of mixed connective tissue disease, which is also an autoimmune disease. It has overlapping clinical features with various connective tissue diseases such as lupus, scleroderma, myositis, but there really, again, was nothing in the question that suggested any of those autoimmune connective tissue diseases or mixed connective tissue disease, and also likely an incorrect answer. And lastly, let's talk about A, which is the second highest selected answer choice, anti-TSH receptor antibodies. So this is suggesting Graves' disease. Now, Graves' disease is also an autoimmune disorder associated with the thyroid gland. And it is associated with thyroid stimulating hormone, or TSH receptor antibodies that actually bind and activate the TSH receptor. So you're stimulating thyroid hormone synthesis. This will cause secretion of thyroid growth as well, and you would get an enlarged thyroid gland, which is what our patient had as well. However, the excess production of thyroid hormones would result in clinical signs and symptoms of hyperthyroidism, which is the opposite of what our patient had. Our patient had signs and symptoms of hypothyroidism, which is why this answer choice is also incorrect. So hopefully by now you guys are getting the hang of our approach and it's becoming familiar to you. We'll go ahead and do one more question. So we'll begin once again with step number 1 by covering up our answer choices. As you can see, we've already done that. We'll move on to step number 2 and read the last sentence first. So which of the following is an adverse effect of this patient's medication that likely delayed his diagnosis? So kind of a long question there. So make sure that we are reading that very carefully. So we are looking for which drug prevented an early diagnosis of his condition, and then what specifically is an adverse effect of that drug that may have done this. So let's move on to step number 3 and figure out how many steps this question requires. By looking at this, we can tell that this may be a 3-step question. First, we need to figure out what is causing this patient's symptoms, what drug is the patient taking that may be involved with delaying the diagnosis, and then lastly, specifically, what is the adverse effect of that medication? So we're going to keep all those things in mind as we go through this question step. So let's go to step number 4 and read that question one sentence at a time. So a 68-year-old man with type 2 diabetes mellitus, hypertension, and a recent myocardial infarction presents to the clinic with weakness and confusion. He has been seen several times this week for similar symptoms, but sent home when his history and physical exam failed to reveal a cause. His temperature is 36.7 degrees Celsius, blood pressure is 146/88, pulse is 82, and respiratory rate is 19. On exam, the patient has dry oral mucosa and decreased skin turgor. Current medications are rosiglitazone, atenolol, captopril, and a baby aspirin. At this visit, the physician decides to draw labs. Sodium is 140, potassium is 4.9, chloride is 101, bicarb is 23, calcium is 8.7, magnesium is 1.6, phosphorus is 3.5, BUN or blood urea nitrogen is 25, creatinine is 1.3, and glucose is 1010. So let's move on to step number 5 and let's reread that last sentence. Which of the following is an adverse effect of the patient's medication that likely delayed his diagnosis? So once again, I want you guys to take a second to think of what you think might be going on before we uncover those answer choices. So now we'll move on to step number 6, and we will uncover those answer choices for you. So now we'll again move on to step number 7. So again, we want you to start at the bottom, answer choice E, and work your way up. We'll go ahead and open up that poll for you. Go ahead and select the answer choice you think is the right answer, and then we will talk about it in just a few seconds.
All right. Last question, so let's make it a good one. So I'm going to open up the poll. And so if you think that the adverse effect is hyperlipidemia, click A, mass tachycardia, click B, rebound hypertension, C, renal insufficiency, D, sedation, E. Or about a quarter of you folks have answered. All right, close to half of you have answered. We'll keep this open for 5-10 more seconds till we get maybe close to 60%. All right, 2/3 of you answered, so I think that's enough of a quorum. So let's go ahead and close the poll and share the results. And what you see is we see 2 spikes. About a third of you said mass tachycardia, and about a little over a third said renal insufficiency, and then and then scattering in between. All right, so this will be interesting to see what pans out. So let me close the poll, and the answer is mass tachycardia B, which was actually the second most popular answer. So I will hand it back to Paras.
Thank you, Dr. Lee. So let's review this again together. And again, we'll start at the bottom and work our way up. Answer choice E, sedation. So we'll talk a little bit more about what's going on. Sedation can be a side effect of some of the medications this patient's taking, specifically atenolol, but this patient isn't really complaining of sedation or fatigue. Instead, he's presenting with confusion, weakness, and hyperglycemia. And this suggests an alternate diagnosis. Answer choice D, renal insufficiency. This was, I believe, the most selected answer choice. Let's talk about this for a second. Renal insufficiency is not a side effect of atenolol. However, you could argue that he does have renal insufficiency given his elevated creatinine and BUN. However, the key thing here is we need to figure out what is the diagnosis. This was a 3-step question as we talked about. So what is that diagnosis? What is the medication that is being talked about? And then what's an adverse effect that delayed the diagnosis? So the key thing here is what is that diagnosis? So as we'll talk about, the culprit medication here is actually atenolol. And we'll talk about that in just a second. So let's talk about answer choice C real quick, rebound hypertension. That is not associated with beta blockers. And now let's talk about answer choice B and why answer choice D is incorrect. Masked tachycardia. So this patient is a 68-year-old man presenting with signs of dehydration. They told us he had dry mucosa and decreased skin turgor. They also told us that he had a blood glucose that was in the thousands. So his condition is most likely to be associated with a hyperosmolar hyperglycemic state. Now, in addition to volume depletion, these patients typically present with tachycardia. However, in the question stem, his pulse was normal. His pulse was 82, and that likely delayed the diagnosis of his condition. He is taking a medication, atenolol or a beta blocker, that decreases heart rate and decreases contractility of the heart rate. And thus, it can mask the tachycardia that he would have developed with his hyperosmolar hyperglycemic condition. Thus, tachycardia is one of the hallmark or warning signs of hyperglycemia or hypoglycemia as well, and that was masked by his beta blocker. So the adverse effect of that beta blocker is masking tachycardia associated with glucose irregularities, and thus why answer choice D is incorrect as well. And lastly, hyperlipidemia. This is an adverse effect of atenolol, but doesn't really have any bearing on what's going on in this condition. So we've gone through 4 questions together. Hopefully going through those all with our question answering dissection technique has helped and you've learned from them. Remember, it's important to stay consistent with your approach as you do all of your questions. And then I will hand it back to you, Dr. Lee.
All right, thank you, Paras. So let's wrap it up with some question dissection, advice here. So as Paras mentioned, you need to have an approach. We have a 7-step approach that we favor. We think it's very high yield and useful. It seems like a lot of stuff, but you can move through it very, very quickly as you're going. It becomes second nature as you go through it, but allows you to not skip useful information. Try to when you're breaking down the STEM, try to utilize all the information provided. Some of the information, may be more relevant to others. They don't try to minimize the use of red herrings, so they're trying not to, quote unquote, fake you out. But sometimes they will give you information that is common to that's commonly presented or commonly elicited as part of the presentation or the laboratory findings, and you just gotta you gotta figure out what's high yield and what's not all that useful. And then remember that each question is created to a specific topic. So ask yourself, what are the question writers are trying to get at? So just a couple of things to keep in mind as you're going through, the step 1 style questions. And then let's talk about some study tips. This is something that we talk about in our broader Path to 250 talk, if you've been on that talk before. So a couple of things to keep in mind is to establish a study schedule and stick with it. A lot of times it turns out that if you plan ahead of time, and we do actually have a study schedule on our website at USMLE-Rx.com. If you plan ahead, set your goals early, and coordinate the studying with your school's coursework and or what else you're doing, you should be able to stick with it and just make minor adjustments. The other thing is while you're mostly while you'll be doing a lot of questions, there are other methods for studying in terms of self-explanation, exposition, and we've given so there's a variety of techniques that you can utilize in addition to questions and tie it together with your use of high yield resources like first aid and whatnot. The other thing that's not here, I think it kind of fell off, is that as I mentioned earlier, you want to integrate everything. So when you learn something, integrate it and try to connect the pathology with the mechanisms of disease, with something on the genomics side or the molecular biology side, or with the treatment and then the side effects and so forth. There are certain subject areas that if you start to run short of time, you may want to save more towards the end, like micropharmacology and metabolic pathways tend to have well-structured information content that is easier to learn and retain. But if you're cramming it, you forget it more easily. So that's why you might consider saving those subjects towards the end if you have a choice. The other thing we want to counsel you is that you want to focus on things that you've learned previously, because those are much easier to relearn, especially if it's high yield. Tied to the study schedule, try not to overschedule. Make sure you take time for yourself. Make sure you don't burn out. So that means exercise, spending time with significant others, friends, family, and we do have a checklist at the beginning of section 1 in first aid that helps you stay relaxed and grounded, so you can be deliberate in your planning.